Welcome back. It's something that's common among athletes, sports injuries that involve the hand.
Dr. Gary S. Kitay is one of the orthopedic surgeons with Jacksonville Orthopedic Institute. Welcome. You are a hand specialist, yes?
I am.
Okay,
hand
so
and upper extremity, yes.
Tell me about what are the most common injuries you see?
Well, for sports, that's a significant part of the practice. You know, here living in Jacksonville with our city's youthful spirit, our great weather, people are out there exercising a lot, challenging their bodies, but with those challenges sometimes comes injuries.
Yeah.
And it's really very sports specific. So skateboarders are out there and they're often falling onto their outstretched hand and they're getting injuries to a bone called the scaphoid and getting scaphoid fractures. And gymnasts, young people, they're getting gymnast wrists. We're having a lot of people that are going skiing now and coming back and they're falling with their ski poles and getting skier's thumb. But in general, the most common thing that I probably see is injuries to the ligaments in the fingers, which are sprains and dislocations of the small joints of the hand. Is probably the most common thing.
Yeah.
And
yeah.
You work with the Jaguars,
Sure do.
and so they're constantly having, I mean, I'm sure you see people every single week. How do you tell a guy, if he's like, it's okay, just tape it up, doc, how do you permit a guy to go back into playing?
Well, that's a complex question, and it's a real balance because the number one thing is first safety. Because you got to be safe, and you're talking about on the elite athlete and the professional level, there's a lot of pressures. They want to go back to play. The team wants them to play. But the first thing you have to impress on them is you don't want to have any long-term risk to their continued success on the field and off the field when they're done playing. So that's the first thing. And you have to look at the position they play, the severity of the injury, and putting all that together is how you determine it. But it's never black and white. There's a lot that goes into that consideration.
And you just touched on something as far as the different positions that you played. Do you treat, like, how do you treat the same injury? Do you treat it differently for different positions, like quarterback, linebacker, mascot, you know?
Yeah, absolutely. So you're talking about the skilled positions, you know, wide receiver, quarterback. When you're talking about just hand injuries, so those are absolute necessities for handling the ball. When certain positions, like certain an offensive lineman, sometimes you can have an hand injury that you can protect in a very large immobilization device like a cast, sometimes a big club, and they can still play and be safe. Of course, you're not going to have a wide receiver or quarterback playing with a large club in their hand. So all that
right.
goes into the consideration.
Yeah,
as well.
you usually only see the linebackers or the defensive linemen with the large cast on.
That's right. That's right.
Now, it's not just professional athletes that you treat. You treat recreational athletes as well. Do you change your protocol for recreational athletes versus professional athletes?
So that's a yes and no. So no, and that's the same concept. You got to be safe, but yes, in that in that with a high performance athlete, there is that greater pressure to play, and sometimes they're willing to do things to get back quicker. So if you or I might have an injury, we say, okay, let's treat this in a cast. It might be a month or 2 months or 3 months. I'll take that. I can invest that time, which a professional might not be able to or be willing to. And sometimes, for instance, we talked about wrist fractures or scaphoid fractures. You can get somebody back playing quicker with an operation. So sometimes it sounds aggressive, but it can get someone back to their goal quicker. So that's how you have to consider that and discuss it all with the patient. It's an individual approach.
You have some stuff on the table there. Is that what you're talking about? Whereas, like, instead of a hard cast, you might put them in the foam?
Right. So this splint right here, this is actually custom made with a 3D printer. So the patient is measured.
Let's hold that up there so that we actually get a view of that. There you go.
So the patient is measured, and this can be made, and it can be made so that it's not removable or that it is removable. That's an example of one type of splint that we can apply at Jacksonville Orthopedic Institute and at our rehabilitation department. For a lot of things where we want to keep the fingers moving, it's just putting on something that's called buddy tape. You put it on your
The hurt finger?
Yep, you put it on your finger, but you want to keep it mobile, so you immobilize it to the finger next to it so that it's protected, but it can still So it's called a dynamic splint, so you can still move it.
Had to do that a bunch. Had to do that a bunch over 19 years.
I bet you did.
Yeah.
I bet you did.
Jam fingers on high fives. Kids like to high five way too hard.
So what about people that want to make an appointment with you? How could they go about doing that?
Well, they can go to our website. It's the website at Jacksonville Orthopedic Institute, or to our central phone number. It's JOI 2000.
All right.
And anybody who has concerns or feels that they have an injury that's lingering, they shouldn't hesitate.
Yeah, anytime. I mean, the difference between a real injury and I mean, arthritis is, you know, a nagging injury, but that's something you need to come see you guys over, right?
Right. If there's a deformity that's not going away, if there's bruising or pain, or they're not able to regain their motion after a few days, then it's probably investing in the time to have someone who knows how to examine the hand, evaluate them. Yeah.
Well, thank you so much, Doctor, for being with us and bringing all your neat stuff and telling us about this.
Yeah.
And we'd also like to thank Jacksonville Orthopedic Institute for sponsoring this segment. For more information, you can visit joi.net or you can give them a call at 904-JOI-2000.
This is cool. I feel like Thanos, you know, the glove thing, but this is so cool.
I know who Thanos is.
This
Do
is,
you?
I do. This is solid. This is
Those
solid.
were like those cookies you had here
Well,
earlier.
I had a broken arm once, and the worst part is getting in the shower or swimming. So like kids who are active or that still want to be able to swim and get it wet. This is
really
cool. Amazing. This
and,
is
our,
like,
and our friend Dr. Gary S. Kitay brought that by. Yeah.
That is so cool.
From JOI.
I love that. It's a little small for me, but
Yeah.
very cool. The advancements. What a time to be alive. This is so cool.